Actually, as you heard, like Professor Lin right now is a NUS society professor and a society chair professor. Actually, he's a founding editor, founding director of the iHealth, basically the Institute for Health Innovation and Technology. He's also the founding director for Singapore Health Technology Consortium. I would say CT published many papers on top journals, and he's elected fellows for several major biomedical engineering societies, and he's also the fellow of National Academy of Science Singapore and also Academy of Engineering Singapore. So as you heard from the previous dialogue, CT is very successful for translating the technology in the lab toward commercialization. He has founded 6 startups already, and is a really successful model for all of us, especially working on the translational research part. And CT's research actually topic is pretty broad, from mechanobiology to wearable sensor to like microfluidics. And today he will bring us, I believe it will be a wonderful talk, microfluidics for disease and wearable application from bench to bedside. Let's welcome CT.
Thank you so much, Wei, for the introduction. First, I want to congratulate you for being awarded the ACS Nano Rising Star Rising Lecture Award. That was really a big achievement and well deserved. And I also want to thank Alice as well for inviting me to give this talk. I think Alice I want to also congratulate her for organizing such a very successful ICANX talk forum. I think it has actually reached out to really a large audience, and since this is all about science, I think this is only good for science, because we also want to interest the younger people to be able to be not only interested in science, but realizing that science can actually benefit many people, and hopefully they will also think about choosing science to be one of their careers. And also I'm very happy to also be able to give this lecture together with my good friend Xiao Dong as well. We have been collaborating for many years, and I think also he has been doing a fantastic job in this area of flexible electronics. Okay, let me see if I can share the screen. Alice, I'm not able to share the screen. Alice, I'm not able to share the screen. Okay. No, I think it's actually not. I'm not able to. Okay. Yeah. Okay. Yeah, I got it. Okay. Right. So yeah. So first, again, it's really a pleasure for me to be here to give this talk. For this particular lecture, I'm going to talk about some of the microfluidics technology that we developed not only for disease diagnosis and personalized therapy, but also for wearable applications. And we also try to showcase how we have actually bring some of this technology developed in our lab to commercialize them and then to bring them to the bedside. So this is the outline of my talk. First, I will give an introduction to actually my research area, which is actually mechanobiology and human diseases, and actually how we actually move from this basic research to translation research, which is the microfluidics area that we're going into. And then I will showcase 2 particular technology we've developed. One is in the area of cancer diagnosis. The other area is in wearable sensing application as well. So when I first started my research, I actually went into the area of biomechanics or mechanobiology. Actually, my background is mechanical engineering. I did my PhD in Cambridge. In fact, during that time, I was actually working in a non-bio area. I was working in the area of impact mechanics. So when I came back to Singapore and started working in NUS, I thought that, and during that time, there was a lot of interest in biomedical sciences. I looked at the whole area. I thought that maybe there's something I can contribute as a mechanical engineer. And that leads me to the area of mechanobiology research. In this area of mechanobiology research, basically what we're very interested is to understand how mechanical factors such as mechanical forces or its mechanical environment, for example, the substrate that the cell is adhered to, whether it's stiff or soft, can affect not only protein but also cell and tissue function in both health and disease. And so I started doing basic research, trying to conduct mechanobiological studies on diseases. The first disease I actually started was actually malaria. So malaria is a disease where the parasite would actually invade into the red blood cell, causing the red blood cell to be very stiff and very sticky. And the second disease is actually cancer. And for cancer, it's the other way around. When a cell becomes cancerous, actually some of the cancer cell type will actually cause the cell to be less stiff, less adhesive, and hence the cell is able to detach from primary tumor and start to metastasize to a distant site. So the approach towards studying diseases is actually quite novel and quite different. So when I first started my research, I was talking to clinicians and biologists. They couldn't understand what we were trying to do, but thankfully, after a few years of research and with a lot of interesting findings, they come to realize that actually this is another interesting angle towards studying diseases, because by conducting mechanobiological studies, we can actually obtain very novel biological insights into the pathology of diseases. So if you look at this picture over here, this is actually malaria-infected red blood cells. And because the cells becomes very stiff and very sticky, it clogs the blood vessels. So using some of the engineering tools we have, we were able to actually probe and measure quantitatively how stiff or and how sticky the cell has become. So with these biological insights and being an engineer myself, we wanted to see how we can make use of the results we have obtained from this basic research and translate and turn them into very novel diagnostics and therapeutics. As a result of this, we managed to develop quite a number of different technologies, and this gave rise to 6 spin-off companies that we have actually started here at NUS. So in general, in my own research group, half of the group actually work on basic research, the other half on translational research. And our aim is towards clinical relevance and utility, and to bring our research and outcome from the bench to the bedside. And after all, basic research actually is still important. Although a lot of people say that they know me for doing translational research, but actually I do a lot of basic research as well, because without basic research, there's basically nothing to translate. So these are some of the innovative technologies that we developed in my lab, and they range from microfluidic chips to wearable sensors. I won't be able to talk about all of them, but in this talk, I'll focus on a few of the technologies that we have developed over here. And of course, the ultimate aim is to see how these technologies can benefit the users and the society. So in this talk, I'll focus on microfluidic technologies, and our aim is to use microfluidic technologies not only for disease diagnosis and personalized or precision therapy, but also for monitoring. So if you look at this figure over here, there are 2 parts to it. The first part is in vitro monitoring, where we actually develop microfluidic chips where we can actually isolate, for example, cancer cells, microvesicles, and exosomes for diagnosis. And the other part is how do we actually use microfluidics and turn them into wearable devices. So one is for what we call in vitro monitoring. The second is for in situ monitoring. So let me first focus on the in vitro monitoring using microfluidic technology. So that leads me to the first part of my talk, which is on cancer diagnosis. So cancer is actually one of the top killers in the world, the other one being cardiovascular diseases. And in fact, for a patient, if the cell becomes cancerous, it is actually capable of developing into a tumor, a primary tumor. So if the cells are not malignant, they are benign, it stays as a tumor, and if the patient goes for surgery to remove the tumor, the patient will recover from it. However, some of the cells will become malignant, and what happens is the cell starts to detach from primary tumor and squeeze its way into the circulatory system. And it will make use of the circulatory system and travel from one location to another location. And some of the cells are able to squeeze back to form a secondary tumor or metastatic tumor. So for example, breast cancer cells can actually detach from its tumor and then start to metastasize and travel to the bone to form a bone tumor. And this is one of the two routes of metastasis. So cells can metastasize to the lymphatic system or to the circulatory system. So for our case, we are very interested in cells that is metastasizing to via the circulatory system. So if the cancer cells is in the blood system, it's called a circulating tumor cells. In short, we call it CTCs. And these are cancer cells that has been released into the bloodstream. And we know that metastasis is the main cause of cancer death. In fact, more than 90% of patients will die from metastasis. So because cancer cells are able to actually travel through the bloodstream, there are in fact many different other circulating biomarkers. Circulating tumor cells, or CTC, is one of them which I've introduced. In fact, in the blood itself, there are also circulating tumor DNA, RNA, exosomes, and proteins as well. So there are many other research groups that are also looking at how to isolate circulating tumor DNA or even RNA, exosomes, and so on. For my own research group, we actually are focusing on just seeing how we can actually isolate these cancer cells. In fact, when I first started this research, that was almost 15 years ago, and during that time, the field was still very new and very, still very young. And during that time, and even right now, the gold standard for cancer diagnosis is through the tumor biopsies. So how it works is the patient will go to the hospital, and the doctor will take a sharp needle, will poke into the body to sample some cells from the tumor. Once they get the cells, then they will send the cell for molecular analysis, like for example, genetic sequencing and so on. So tumor biopsies itself is highly invasive. The patient will suffer a lot of pain, some pain, and we cannot do it frequently because it's highly invasive. The patient can only do it once, say, before chemotherapy treatment and once after chemotherapy treatment. And so this is like almost like half a day to a day surgery. So, however, if we can take the cancer cells from blood, which is what we call liquid biopsies, this is a very less invasive, less painful, and in fact we can do it more frequently. So the cost as the patient undergo drug therapy or chemotherapy, we can still, for example, every 2 weeks or every month draw blood from patients and analyze the cancer cells. So there's a lot of advantage in doing liquid biopsies versus tumor biopsies. Of course, when we first talk to the clinicians, they are still very much, going for tumor biopsies. But during the time, we're telling them that we can still do tumor biopsies, but if we can also do liquid biopsies and complement this tumor biopsies test, then hopefully this will help to change the way cancer can be treated and diagnosed. So in fact, it's in only the last few years that a lot of people are recognizing that liquid biopsies is a game changer. In fact, there are a lot of not only engineering but also clinical magazines that are saying that liquid biopsies is one of the top 10 or top 9 medical technologies. And although right now it's still not quite the standard being used in the clinic or hospital, I'm betting that in the next maybe 5 to 10 years, it will become a standard test to be performed in the hospital. So when we first started this research, we wanted to see how we can get cancer cells from blood. However, there are a lot of challenges. Firstly, blood itself has about 40 to 45% hematocrit. So in 1 ml of blood, there are about 5 billion red blood cells. But cancer cells or CTCs are very rare. So if 1 ml of blood, there are 5 billion cells, 8 million white cells, but there are less than 10 to over 100 CTCs. So it's almost like, in this whole world of 7 billion or 8 billion people, you're trying to look for 10 to 100 people. And this whole problem is what we call trying to find a needle in a haystack. It's extremely challenging. The other thing is also cancer cells are heterogeneous. Some are more epithelial, some are undergoing EMT, some are cancer stem cells. So they express very different proteins on the cancer cells. And because of that, if we were to use an antibody to try to capture cancer cells, which is actually the normal way of trying to capture cancer cells when we first started this research, we can only capture a subpopulation of cancer cells, but not all the cancer cells. So we're trying to see if there's a way for us to do what we call label-free method. It means we don't use any antibodies to capture the cancer cells from blood. So as I mentioned, when I first started my research, we did a lot of cell mechanics experiments. So we first started with blood cells. So for example, we use optical tweezers to stretch a red blood cell like this. You can see the red blood cells are very deformable. We also use a micropipette to aspirate red blood cells as well. So again, you can see how deformable the cell is. We have also been using microfluidics and squeezing red blood cells through a small channel like this. So this series of experiments can help us to be able to quantitatively probe how deformable the red blood cell is. But when we started to work with cancer cells, you can see from this movie that cancer cells takes a longer time to squeeze through the channel. So this shows how stiff the cancer cell is. In fact, when we were to plot, for example, looking at the cell size, we know that certain cancer cells are actually much larger than red cells and white cells. So they're typically maybe 15 to 18 microns and larger. But in terms of the numbers, as I mentioned, CTCs are very small very rare compared to red cells and white cells. So here, the relative cell abundance is in log scale. But after doing all these cell mechanics experiments, what we have found is that, and this is in log scale, the CTC is actually at least an order of magnitude stiffer than white cells. And red blood cells are, of course, the most deformable cell in the human body. So it's actually right down there. So from this set of tests, we know that cancer cells are more stiffer than white cells and red cells. So if this is the case, right, and if circulating tumor cells, although they are few in numbers and exist in a huge population of blood cells, can we use the difference in biophysical properties such as cell size and deformability and use that as a kind of a biomarker for us to enrich and diagnose cancer? And so this is what we're trying to do. Instead of using antibodies to try to capture the cancer cells, we're going to make use of biophysical markers, the differences in cell size and deformability to capture cancer cells. And so this research actually led to us to develop quite a number of different microfluidic chips for personalized oncology. So in fact, in our lab, we have developed many different microfluidic chips, from detecting CTCs to doing single cell analysis to doing CTC culture or even isolating cancer cells from urine, to developing microfluidic chip to isolate microvesicles and exosomes. We also have a microfluidic chip or system where we can do blood salvage, meaning we can actually be able to, if a patient undergoes, for example, tumor surgery to remove the tumor from the spine, and most of the time when the patients undergo surgery, they lose a lot of blood. So can we actually take back the blood, clean it of the cancer cells, remove all the cancer cells, and then route the clean blood back to the patient? So we also have done some tests in this area. But for this talk, I'll focus on CTC detection, isolation, and CTC culture. So first, we wanted to see if we can capture CTCs from blood. And as I mentioned, CTCs are very rare. So we developed a suite of microfluidic devices to do that. First, I'll show you the microfiltration CT chip. So in this microfluidic chip, what we're trying to do is to see if we can physically trap and isolate the larger and stiffer cancer cells from blood cells. So again, we're not going to use any antibodies or biomarkers to isolate them. And from this movie, you can see that this CT chip comprised of a PDMS chip mounted on the glass slide. And inside this microfluidic chip are these semicircular traps. So these semicircular traps are the ones that can trap the cancer cells. so how does it work? So this is what we call a pachinko chip. So pachinko is like a ball bearing machine that's in Japan. So basically, it's almost like a ball bearing falling down and encountering obstacles. So if you were to look at this movie here, we actually flow blood cells and cancer cells. And within this microfluidic device are actually these 3 micropillars. So each of the micropillars will be able to trap a cancer cells. So if you look very carefully, right, for example, this row of the cell trap will tilt slightly towards the right, and the second row will tilt slightly to the left, and they are staggered. So in this microfluidic chip, there are about 14,000 of these cell traps. And the idea is that as the cancer cells flows through this device, if it's stiffer and larger, it gets trapped like this, whereas the rest of the red cells and white cells will flow through this device. So again, just to show you how it works, when a cancer cells encounters the 3 micropillars, it'll get stuck like this. So after the blood has flowed through, the way what we try to do is, how do we actually retrieve the cancer cells? We retrieve by reversing the flow. So when we reverse the flow, we are able to retrieve the cancer cells. So from here, then we are able to retrieve the cancer cells from the blood itself. So just to show you how complex this blood is, this is a movie showing you how we process kidney cancer patients' blood. So from here you can see there's huge amount of blood cells flowing through this device, and this is a bit hard to see, but I'll show you a close-up movie. So over here you can see that these are the 3 pillars, but over here there is actually a cancer cell, and over here there's another cancer cell. So this is actually processing real patient blood, and through this device, we're able to trap the cancer cells. However, this device took us about 3 hours to process 7.5 ml of blood. So we felt that the time taken is too long, and we wanted to see if we can develop other microfluidic device to make the processing much more quicker. So that leads us to the Spiro microfluidics. So this is a very interesting microfluidic device that we have. Over here, we will input blood through this channel, allow the blood to flow through a spiral channel, and as it comes out, the larger cancer cells will actually focus near this wall of the channel. The smaller cancer cells will get focused away from the channel. So through the sorting of the larger cancer cells from the smaller blood cells, we are able to separate the cancer cells from blood. And how does it work? Actually, when cells are flowing through a channel like this, they will undergo 2 types of forces. One is the inertial forces. So the inertial force will comprise of shear induced lift force, which will direct the cell towards the wall of the channel due to the Poisson flow. But there's also a wall induced lift force that will push the cell away from the wall of the channel. So they will actually equilibrate at a certain position. But if the channel is a curved channel, then what happens is there will be a centrifugal effect on the fluid, and this will induce a counter-rotating dim vortices. So this counter-rotating dim vortices will create what we call a drag force. And so the principle of inertial focusing basically is based on inertial forces and dim drag force. So if you were to look at this formula here, the lift force over the drag force actually varies with the diameter of the cell to the power of 3. So what it means is that if the diameter of the cell is larger, the lift force is higher, and that will pull the larger cells towards the wall of the channel. If the cell size is smaller, then the lift force is lower, and the cell will actually relocate away from the wall of the channel. So by using this principle, we are able to separate the larger cancer cells from the smaller blood cells. And this is the schematics of how our chip look like. We will input blood over here, let it flow through a spiral channel, and let me show you a movie of what happens when the blood is at the outlet. So at the outlet, basically, we're able to separate the cancer cells from the smaller blood cells. So it's a very simple device. By just passing blood through a spiral channel, we are able to separate the cancer cells from the blood cells. So this is a very simple, easy to use device. And for 7.5 ml of blood, we can actually process it within half half an hour to 45 minutes. In fact, later on, we came up with a version where we can even process 7.5 ml of blood within even 7 minutes. So we did many clinical tests. We actually take blood from cancer patient, and we will, let me just show you results from lung and breast cancer. For lung cancer, we actually try to see if we can capture cancer stem cells. So we stain for CD133, CD44, and a few other biomarkers. So just to show you one set of results, we actually were able to stain for CD133, which is a biomarker indicating that we are able to capture the cancer stem cells. For the clinicians, they are very interested to look at what we call ALK translocation or mutation. So over here, we do fish staining, and we found that we are able to actually detect ALK translocation. So ALK is a kind of mutation which is treatable by the drug crizotinib and ceritinib. So if we can do fish staining of the CTC or cancer cells, and we found that it's positive for ALK, then we know the right drug to treat the patient. So this is what we call precision therapy or personalized therapy. We take the cells from a patient. We found that we do the test, and we found that the person has the mutation, and the mutation is treatable by a certain drug. Then we will administer the right drug to the right patient. And although ALK occurs in only 4% of the lung cancer patient, it is one mutation that is treatable by these two drugs. So this is one test that we wanted to do. The other area is breast cancer, where we are looking at HER2 amplification. So HER2 amplification will result in breast cancer cell being able to proliferate and grow uncontrollably. So we again do fish staining, and we found that some of the CTC will stain positive for HER2, and HER2 is actually treatable by the drug Herceptin. And HER2 actually occurs in, I think, around about maybe 30% of the breast cancer patients. So again, it's a very important mutation for us, very important marker for us to look at, because if there's HER2 amplification, then we know there's a right drug to treat this HER2 amplification. So because of this, we got very excited, and when we showed to the clinicians, they also got very excited, and they wanted to use it, and they wanted us to build a machine to place in their lab for them to use to test on clinical patients samples. And when we talked to them, we realized that we are indeed helping to solve a need and help to solve a problem. So we decided to sell a company. Initially, it's called Clearbridge Biomedics, but we changed our name to Fluidics recently. And it took us 1 to 2 years to develop this system, but we discussed a lot with the clinicians that they wanted a system that's idiot-proof. So if you look at this system here, it's very easy to use. The whole microfluidic chip is housed in a cartridge, and this cartridge can be mounted on the top here. Then what we do is we collect 7.5 ml of blood and plug it over here. We press a button, and within about 45 minutes, we'll be able to collect the cancer cells from this tube over here. So we came up with this system, and finally, we were able to not only get our CE-IVD mark, but we have also obtained China and US FDA listing. And right now, this system is installed in around 90 locations around the world. And this is the company that was IPO in 2018. In fact, it was quite an adventure and also a journey for us. We managed to win many awards along the way. So it was a confirmation of the innovativeness of this particular technology, but at the same time also help to publicize our technology to the world. So right now we are further developing some more other microfluidic chips to see how we can better actually isolate CTCs. But of course, the idea is that we want to have a technology like this where we can get the blood from patients, use our CT chip technology, isolate the cancer cells, and then perform genetic and molecular analysis. And with the information, we can actually put it in the report like this. So when the doctor look at it, they not only know the cell count, but they also know what the mutations that is treatable by drug. Then they can administer the right drug to the right patient. So the aim is to go towards personalized treatment of patients. So when we were doing all this research, some of the clinicians started to tell us that are we able to actually culture some of these cancer cells obtained from patients? And when we were doing this research, we found that actually culturing of CTC is is quite challenging. And the reason is because once cancer cell is taken out of the human body, it doesn't survive very well. And the reason why clinicians are interested is because, if we can take, for example, CTCs from patients, we call it patient-derived CTCs. We either do sequencing and then look at any mutation the patient may be suffering from, and then administer the right drug to the right patient. Some clinicians will actually inject the cancer cells into, for example, a mouse. We call it patient-derived xenograft model, or PDX. And the tumor will grow in the mouse, and then they will do a drug test to see if the drug can kill the tumor. The other approach is to try to get the cells out and then grow into a tumor organoid. So tumor organoid is actually quite a hot area now. However, there's no guaranteed success in forming a tumor organoid. It also takes quite a long time to form into something like this. The third approach is whether we can get the CTC and just culture them and grow them into a CTC spheroid or cluster. So the idea is that if we can do this, then what we do is we can do a drug screening to see which is the right drug or the best drug to treat this particular patient. Because we are taking the cancer cell from this patient, we grow them into a spheroid, and then we do drug tests. If there's a certain drug, a certain dosage or combination of drug that can treat the patient, then we can actually be able to better decide which is the best combination of drug or dosage to give to the patient. So we decided to see if we can do a CTC culture. And during that time, there were a number of papers published, for example, in Nature and Science and New England Journal of Medicine, where the success rate is about 20-30%. And they did about maybe 20-30 samples to show that they are able to grow CTCs. But the success rate is, to us, 20-30% is still not very high. So we wanted to see if we can further improve that. So we developed a microfluidic assay like this. If you look at this microfluidic assay, there are three layers to it. At the bottom are actually micro wells, specially designed micro wells where we can grow the cells. The second layer are channels where we can input drugs of different dosage and combination into different channels. And then the third component is a gradient generator, where if we input, for example, 2 drugs, we can actually use the gradient generator to generate different combination or dosages of drug into these different channels. So this is how it looks like. This is it's a kind of oval in shape, elliptical shape micro well. So it's about 250 microns in length, and the minor axis is about 200 microns. And we managed to grow the cells in this micro well. And of course, the idea is that first we want to be able to take the blood from the patient. And after taking 7.5 ml of blood, what we do is we will do a RBC lysis first to remove all the red blood cell, and then whatever that's left, which is the white cells and cancer cells, we would then pipette them into this microfluidic assay. So we will pipette the cells into the micro well, grow it over 2 weeks. Then after that, we will perform a drug test. We'll do a short-term perfusion of drug into these different channels. And once the drug is perfused into the CTC clusters or spheroids, then we observe whether the cancer cells get killed or get destroyed. So through this device, then we will be able to determine which is the best combination of drug or dosage of drug that will be able to sufficiently kill the cancer cells. So we did this test, and in fact, we found that because of a few factors, we were able to actually obtain success rate of greater than 60%. In fact, we did more than 400 clinical breast cancer samples over almost 4 to 5 years. And we were able to obtain success rate, I think partly because of a few reasons. One is because of specially designed microwell. Second, we actually grow it under a hypoxic condition. That means very low oxygen condition, which actually favored the growth of the cancer cells. And then third is that earlier works actually try to isolate the CTC before they actually culture them. For us, we just do a RBC lysis, and then whatever that's left, we actually throw them into the microwell and then try to culture them. So these different factors enable us to have greater success rate in growing the CTCs. So we also follow patient through, and we found that patients whose cells does not form clusters of spheroids as compared to patients who are able to form clusters of spheroid, the overall survival of patients which can form clusters is not very good compared to patients whose cancer cells are not able to form cluster. So this is a kind of an overall survival chart that we plot from the patients that we work with. So the ability to monitor the disease progression over time could also help us to determine the appropriate modification to patients' therapy and hopefully help to improve prognosis of the patients. So moving forward, now we are actually looking at integrating not only microfluidics with genomics, transcriptomics, and proteomic analysis, but also bioinformatics. In fact, this is another area that we've been working for the last few years, but I don't have time to talk about it. We actually use bioinformatics to analyze the data that we have obtained from all the cancer cells that we have isolated and analyzed. And in fact, in this series of publications, we came up with a panel of what we call ECM gene related panel that can help us to better prognose or diagnose cancer. So if you're interested, you can actually refer to some of our publications over here. But this is actually our approach now to have an integrative approach to precision medicine by using microfluidics and the omics and bioinformatics. So with that, I will now go into the second part of my talk, which is on wearable sensing application. One reason why we went into this is a few years ago, we were actually approached by a clinician and they are using body sensors like this. And they were telling us that the body sensors are very rigid, bulky, and very fragile. And they also kind of limit the use on the human body, because if you strap something so bulky onto the arm or the leg, it may actually impede the movement as well of the person. And so the motivation is, can we come up with a flexible sensors that are not only wearable but also imperceptible, meaning when you put it on your body, you can't really feel that it is there at all. And our aim is towards biomedical applications, which is either disease sensing or continuous monitoring. And of course, earlier on, Professor Chen Xiaotong has already given a very nice lecture about all the different devices that he has developed in his lab. And of course, there are also many well-known researchers who have also given talk in ICANX talking about the various wearable devices that they have also come up with. So we are going to do this very differently. We wanted to see if our expertise in microfluidics can enable us to develop such wearable devices to enable us to do in situ monitoring. So basically, I'm just using this as a challenge for my own group to see if we can develop a wearable device by using microfluidics. So, however, there's a key challenge. There are some key challenges. This is a microfluidic device that's on the microscope stage. How do we actually transform something like this into a wearable device like this? So there are key challenges. So there are a few requirements in order for us to meet such challenges. Firstly, we have to use flexible materials, preferably skin-like in properties. We also need to determine what is the detection mechanism, what is the sensor that we are trying to use in this microfluidic sensors. And the third is it must be able to integrate electronics. There should be encapsulation and bonding electronics so that the data collected can then be transferred to another device like a computer or a tablet or iPhone. So we finally came up with what we call a flexible microfluidic device by incorporating microfluidics with flexible substrate and a conductive liquid. So what is different about our wearable sensors as compared to others is we are using liquid as a sensing element. So this is how it looks like. If you look at this movie over here, the whole microfluidic device is actually very flexible. And also, if you look at the device itself, if you look at over here, the silver line here are actually the microfluidic channel, and they are filled with a conductive liquid. So this is the device that we have come up with. And the idea of this whole device is to be able to have this device mounted on the skin, and then when we go about doing certain activities, we are able to not only monitor physiological signals, but we also be able to capture some of the movement. So that the innovation is that we are able to use a liquid active sensing element, and liquid is highly deformable, so it will be very sensitive, and we also can customize the microfluidic channel to make it either very highly sensitive or not sensitive, depending on the amount of force that we want to measure. So the liquid that we use is actually eutectic gallium edium, or EGAN. It's an electrically conductive fluid, and it's actually liquid. It's at the liquid state at room temperature. So it's about 75% gallium and about 34% edium. The resistivity is actually very low. So it doesn't have very high resistivity, which is good. The other thing is it also has very low viscosity. So when you pour it out, it's almost like pouring out water. The other thing, of course, many people ask will be, what about its toxicity? Actually, it has very low toxicity because these two elements, edium has been used in dental fillings, and gallium has been used as a trace nutrient in multivitamin pills. So what's the working principle? So basically, what we have is a microfluidic channel filled with this EGAN, and then we apply a very small current through it. If we were to apply a pressure, what happens is, because it's deformable, the whole microfluidic channel will actually deform. And as it deforms, there's a change in the current. So from the change in the electrical signal, we can tell how much force is exerting on the sensor. In fact, if we were to press it or stretch it or bend it, we can get different electrical signature. And from the signature, we can tell what kind of forces is acting on the sensor. So this is the working principle behind this microfluidic sensor. In fact, we did many tests, and one of the interesting tests is we actually have a wheel roll over it. So first we press the sensor and we get peaks like this, and then we have a wheel roll over it. So when we roll over it, we get a peak, a sudden peak, and then after that we press it again, we get back the same amount of force as before. So this shows that the whole sensor cell is actually very robust. It didn't break when the wheel went over it. So in fact, after we developed these microfluidic wearable sensors, we wanted to see what are the different healthcare applications. In fact, we applied it to artificial sensing. For example, it incorporated into soft robotics. We also look at whether it can sense texture. We also look at rehabilitation. For example, Insole, looking at measuring insole pressure, object grasping, and finger movement. And we also look at diagnosis, where we can mount this sensor onto the forearm and we can measure grip strength and also finger tremor. I do not have time to go through all the different applications, but let me just show you two. The first that we tried was to measure tremor. So the sensors is placed on the finger when the person simulate tremor, we can actually quantitatively measure the tremor. If we stop the tremor, it will actually start to go to zero or baseline. So this device can enable us to be able to quantitatively measure the tremor, and this is actually very good for application in Parkinson's diseases, where the patient may actually suffer from tremor, and if we were to give them medication, we wanted to see whether there's improvement in being able to stop tremor. So this is one device that can be applied to Parkinson's diseases. But the other area we are very interested in is in diabetes, and our aim is actually towards zero amputation. So diabetes is actually a chronic disease, and in Singapore, it's actually a very serious disease because we are probably one of the world's top rank in terms of the population contracting diabetes. In fact, today in Singapore, 1 in 3 aged 65 and above will have diabetes, and there's also 1 in 3 chance of us getting diabetes in our lifetime. And diabetes actually can lead to a few long-term complications. One is blindness, second is kidney failure, the third is heart attack, fourth is stroke, and the last one is amputation. The amputation is because patients can actually develop what we call a foot diabetic ulcer. So when patients develop foot diabetic ulcers, they will suffer from foot wound infection, deformability, and in fact, foot problem accounts for more hospital admissions than other long-term complications of diabetes. And there's also major adverse outcome of foot ulcers and amputation. In Singapore, we have one of the world's highest diabetes-related lower extremity amputation rate. In fact, every day there are 4 amputations, and 1 in 5 with lower limb amputation will die within a year. And globally, actually, there are 5-year relative mortality after having diabetic foot ulcers, and that's about 48%. So this is in fact higher than most types of cancer, whether it's breast or lymphoma. So this is a very serious problem. So in our lab, what we wanted to see how we can actually help to solve this problem. So what happens is if elderly patients have a diabetic ulcer, they will normally go to a polyclinic or GP to seek help from the podiatrist. And the podiatrist will recommend either a total contact casting, that means your whole leg will be encased into this total contact casing, or they will recommend off-the-shelf diabetic shoes. A lot of patients will not want to go to these total contact castings, but some of them may not mind wearing off-the-shelf diabetic shoes. But the problem is that because it doesn't fit very well, so and also the other problem with diabetic patient is that they also suffer from neuropathy, meaning they don't feel any pain at the bottom of their foot. So if they have an ulcer like this and if they step on it, they don't feel any pain. And that is the problem, because they don't feel any pain, and when they walk, they keep stepping on this ulcer. So what happens is after repeatedly stepping on the ulcer, there's about 30% to 40% recurrence, and the patient will end up with suffering from infection and gangrene, and as a result, they have to go for amputation. So how do we solve this problem? Actually, when we talk to the clinicians, they say that this problem is actually not difficult to solve. One of the easiest way is to see if we can relieve the pressure that's exerting on the diabetic ulcer. That means when they walk, you will try when they walk, they will try not to step onto the ulcer. However, because they don't feel any pain, they will not know that they are stepping on the ulcer. So we developed what we call a smart insole. And this smart insole enables us to measure pressure that's exerting at the bottom of the foot of the patients. So the idea is we embed our liquid active sensing element into an insole like this. And as they walk, they are able to now measure or be able to use these sensors to sense the pressure acting on the ulcer. So this is a demo where my postdoc is actually wearing the insole and then walk, and then on the cell phone we can track the pressure that's acting on the foot. For example, if there's ulcer here and the pressure is too much, we can use the cell phone to alert the patient that the pressure is too much and they need to change their walking pattern to relieve the pressure. Previously, when they were using off-the-shelf diabetic shoes or total contact casting, they weren't able to actually be able to sense the pressure that's exerting on the ulcer. So we found that actually this turns out to be a very important problem to solve, and because there were a lot of interest in this, we started a company called FlexoSense in 2016, and the idea is to have a smart insole like this, not only for the accurate measurement of insole pressure, so that the doctor can better advise the patient how to manage the ulcer or even prevent it, or for the patient to see their pain. They may not feel the pain, but hopefully on the cell phone, they can see their pain via their smart device with clear instruction what to do. And so because we can also collect the data from the cell phone, and the whole data can be uploaded to the cloud. And at the end of the week, we can use AI to generate a report and send to the doctor. So at the end of the week, the doctor can look at the report for this particular patient and see that whether he or she has been taking care of the ulcer. If not, then the doctor can call them to better advise them what to do. So this is a movie to show you how it works. So we have a smart insole, and the person will walk. And this is the app showing all the pressure points. So if there's a pressure is too high, we can alert the patients to take a rest first. relieve the pressure of the ulcer, and then adjust their shoe before they start walking again. So right now, we are actually developing this technology, and hopefully nearer the end of the year, we'll be able to start conducting some clinical trial with this smart insole. So this flexible microfluidic device, certainly we are able to apply to many different applications, not only in disease sensing, but also physiological monitoring, prosthetic sensing, soft robotics application, and even right now we are looking at see whether we can use this in sports monitoring and gait sensing. And of course, the idea is to use this microfluidic wearable sensor that we have and collect the data and transmit it to a cell phone, and then thereafter upload to the cloud. So the last one I want to talk about is actually the soft tubular microfluidic for 2D and 3D applications. Actually, when we first did this research, my aim was to produce a microtube as basic building blocks for the rapid construction of 2D and 3D microfluidic devices without having to use conventional photolithography process. However, after we developed this PDMS microtube, and in fact, we were one of the first, if not the first, to produce tubes that can have inner diameter down to less than 10 microns, we found that actually, if we were to fill it again with the liquid metal E-gain, the whole tube can become a sensor. In fact, this tube is not only highly stretchable, but also very configurable. And in fact, they are so small that we can hardly see it, so it's imperceptible. In fact, to see it, we have to use a magnifying glass to observe it. So this is a tube. It has almost the size of the strain of a hair. So it's a very, very small microfluidic tube. In fact, we characterize this sensor, we stretch it, we press it, we found that it's very responsive, and we are able to actually use it to measure stretching force and also compression. So after we developed this, we realized that this can also be used for different applications, whether it's VR, gaming gloves, soft robotics, e-textile, even pulse monitoring, joint movement, and compressive therapy, and so on. So I won't again be able to go through all of them, but let me highlight a few applications. So the first is actually e-textile. We actually weave this microtubular sensor into a fabric and see whether we can use it to activate devices. So this movie shows you the microtube that we have that is weaved into the fabric. If you press it, we can actually activate devices like this. And so, so this is one application would be that we can weave it into a jacket, and if someone is cycling and want to answer a phone, they can just press one part of the jacket and they will be able to activate the phone. So first we can use this to make what we call e-textile. The second application is quite interesting. So we are also able to use it to do pulse monitoring. Of course, there are many devices developed by many researchers to do pulse monitoring, but we want to make it a bit different. In fact, this could also be used for TCM or PAMI, where we can use the fingers to feel the pulse. And so, how do we do this? So basically, what we did was we weave one sensor like this into the fingertip of the glove, and then with this, we actually press the finger with the sensor, for example, on the inner elbow, and with that we are able to measure what we call bronchial pulse. And this movie here shows you actually a raw data, but from here you can tell we are able to measure the pulse. We also put it onto the wrist to measure the radii pulse, and again we are able to measure the pulse shape. And we can also put it on the neck, where we can measure the carotid pulse. So again, very quickly we are able to measure the pulse from the neck itself. We can also put it near the foot, where we can try to measure dorsalis pedis pulse as well. So this is a very versatile microfluidic tubular sensors, where we can use it to measure pulse at different parts of the human body. We also started to see if we can weave it into bandages, for example, to use it as a smart pressure monitoring bandage. In fact, when we weave it into a bandage like this, and when we start to pull it, we found that actually we can measure the pull force. So when we pull even further, the force increases even higher as you pull it, stretch it even further. In fact, if we were to pull it back and forth very quickly, it's also sensitive enough to measure this back and forth pull stretching of the bandage. So we also try to see if we can use this for rehabilitation. So this is only just one single microfiber sensor. We mount it on the kinesiology tape, and then my student Longton actually flexes his knee, and then from here we can actually tell not only how many times he has flexed his knee, but also how much the flex that he has made. In fact, this is good for patients where we want to track the patients how much improvement they have made in terms of rehabilitation. So when we talk to other clinicians, they are very excited about this because the device can enable them to be able to from here be able to measure how many times the patient does the exercise and how much improvement they have made in a very quantitative way. In the past, when we don't have device like this, they just bend their knee, but we can't tell how much the improvement they have made with time in a very accurate way. Then, of course, some of you may be familiar with the Minority Report, where Tom Cruise used this glove to activate, the screen. So we thought that maybe we can come up with something like this as well. So we came up with what we call a smart infinity glove. For those of you who have watched the Marvel movie Avengers Endgame, there's an infinity gauntlet, but we call our glove the smart infinity glove. And this is quite an exciting technology. In fact, we also have a startup company called Microchip Technologies to commercialize this smart glove. We can now actually use the glove, for example, to play games where we can move the guns and then to be able to do shooting as well. So this is actually one way, one use of this smart glove for gaming. The other interesting area is in terms of VR, where, for example, we have a virtual reality hand over here, and when we use our glove, we can actually use it to also activate a virtual reality hand, a VR hand. So this glove can be used for both gaming and also VR. In fact, there are also other applications. We can use it for diagnosis and rehabilitation. We are also talking to some of our clinical partners to see if we can use it for biomedical training. In fact, using our glove to see if we can be able to simulate some of the medical procedures that we want to apply to the patients. And of course, we can also use this glove for robotic control as well. So there are many potential applications of the smart infinity glove. So finally, I just want to show you an interesting capacitive sensors that I developed. Is a dual coarse fiber sensor. And we wanted to show you that we can develop a sensor that is functionally indestructible. So if you look at this movie here, we have a sensor here mounted on a rubber band. And then there's also another sensor. So this sensor is capacitive microfiber sensor with dual core. And this is a single core resistive microfiber sensor. So when we first started the capacitive sensor, we stretch it, we get forces like this. After that, we stopped it, then we start to cut the sensor into two. So we started to cut the sensor into two, and then we break it up. So after breaking up, we start to stretch it again. And interestingly, when we start to stretch the sensor, we are able to, again, get the readings. So there's a good response to, again, the sensor itself. So this capacitive microfiber is functionally indestructible. Whereas if we use a resistive microfiber, we stretch it, and then after that we try to cut it. The signal is actually broken. So what we do is to show you that we have actually cut it into two. We peel it off, and then we start to pull it again. And when we try to pull it, basically we don't get any signature. So the capacitive sensor itself actually can enable us to have what we call functionally indestructible microfiber sensor, so that when we realize that it's been cut into two, then we can actually be able to replace it later on But this is one interesting aspect or advantage of using a capacitive sensor. So again, we were also very fortunate to get quite a number of different awards for this particular technology, and we are now looking at more other applications for the use of these microfiber sensors that we have. So with that, let me just conclude. Of course, we are talking about smart system 4. Actually, I am now thinking or dreaming of smart system 5. What would the sensors of the future be like? Actually, when it was in the year 2001, almost 19 to 20 years ago, I was reading this popular science magazine, and it shows some of this very interesting technology, which only people are starting to look into it only the last few years. One example would be, for example, bed that is embedded with sensors. So the idea is that now we are looking at wearable sensors, but in the future, people may not want to wear sensors. But if we can embed sensors into devices that we use every day, then that will be something that we can use to monitor a user's health. So, for example, embedding sensors into the bed, we can monitor the sleeping pattern of the person. If something out of the ordinary has happened, then we can see if the patient may be suffering from certain illness. And of course, we look in the mirror every day, and also we brush our teeth. So can we embed sensors into a mirror which can do a scan of our face and be able to tell us whether we are well or healthy or not? And also we can embed sensors into toothbrush like this, where when we brush our teeth, it can sample our saliva, and again using saliva as a biological data for us to see if again is there anything wrong with us from sampling our saliva. Of course, during that time, they were introducing these thoughtful spectacles, and of course now we know there are Google glasses. In fact, this thoughtful spectacles was meant during that time when they present this, was to be able to have the name of the person we see flash across the glass, so that if we as we go older, we start to forget names, and if the name were to flash across our glasses, then we can remember the names, and that will save us embarrassment from forgetting the name of a person that we have met before. But of course, people are now also looking into embedding sensors into a toilet bowl like this. And recently, there was a publication in Nature Biomedical Engineering by a group from Stanford, where they have cameras and sensors embedded into a toilet bowl like this, which can actually be able to measure not only urine flow, but also the stool or the feces that the person is excreting, and to see from analysis whether the person again is well or not well. Certainly, there are a lot more work to be done. For example, we can later on be able to incorporate other sensors to see if we can detect other diseases like colorectal cancer and so on. That will be in the future. But because we use toilet bowl every day, I think this is something which is quite exciting, and something which I think moving ahead will be a very important accessories to use to diagnose our health on a very regular and continual basis. So finally, before I end, I thought I want to share with you a quote that one of my clinician partners tells me. All of us, for me as an engineer, I like to develop biomedical technology, and he was telling me that a doctor can only treat one patient at a time, but an engineer who develops a biomedical technology can enable treatments of thousands of patients anywhere and any one time. I thought that this is a good encouragement for us as biomedical engineers who are developing technology, and this is exactly what we want, a technology that would benefit literally thousands, or not tens of thousands of patients, or even millions anywhere. And so I hope that through this talk also, this will also encourage many of the younger audience out there to also think about becoming a biomedical engineer, and hopefully develop technology that will one day benefit the people. So with that, I just want to acknowledge my collaborators. In fact, there are many. For the kind of research I'm doing, it's not a one lab effort. In fact, it involves many parties, not just engineers, researchers, and students, but also clinicians, biologists as well. In fact, I do publish quite a lot of papers in biology because I'm personally very interested in biology. I felt that I need to know biology in order to better design and develop some of the biomedical devices. And of course, because we want to work with clinical samples, we work closely with clinicians. And we also wanted to understand what are the problems that they face so that we can develop solutions to solve their problem. So I always tell my students, do not develop a solution looking for a problem to solve. Instead, look for a problem where you can develop a solution that can solve that specific problem. So talking to clinicians well ahead is important, because then we know what the problems are. We can help them to develop solutions, and later on the solutions will be better accepted for use by them. And of course, because we also commercialize our technology, we do actually work closely with the industrialists and investors as well. And the other thing is, working in the biomedical technology area, we also need to get regulatory approval. So we need to also talk a lot with the people in the regulatory agencies as well. And finally, also, I'm very grateful to the patients. In fact, some of the patients, for example, the cancer patients, some of them are very sick. Sometimes getting an additional 10 ml of blood from them can be a lot, but many of them are willing to give additional blood out, because they know that their donation will actually help to advance science and research, and hopefully benefit other patients. So I'm very thankful to the patients who I do not know who they are, but they are very generous in donating their blood despite their poor health conditions. For the wearable sensors, I'm also very grateful to my team, especially JC, Yo, and also Long Ten, who has actually two persons who actually work a lot in helping develop both the microfluidic wearable sensors and also the microtubular sensors. And also my other students and postdocs, Si Wang, Kong Fang, and also Ren Hao and Trifany. And also this microtubular sensor is actually in collaboration with my collaborator from Shanghai Jiao Tong University, Professor Gong Xiaobo. He actually spent a year in my lab helping actually to develop the microtubular sensors. And these are all the different collaborators from different hospitals and polytechnics and also funding agencies. Finally, before I end, I just want to actually make an announcement. Next year, we are organizing the IU Peasant World Congress on Medical Physics and Biomedical Engineering. That will be from 31st May to 4th June, and it's going to be held at this iconic hotel called Marina Bay Sands. I think some of you may be familiar with this hotel. This World Congress is held once every 3 years, once in North America, another time in Europe, and in 2021, it will be held in Singapore. So I'm hoping that by then, hopefully the COVID-19 pandemic will be over, and then we can get to meet together in Singapore for this meeting. So all of you are welcome to join us for this particular Congress. And finally, because of this COVID situation, I hope that you would wash your hands regularly, don't touch your face, wear your mask, and keep your distance. In fact, this is a poster that we put out in my lab. And so do keep safe and healthy. And with that, I come to the end of my talk, and I'm happy to take any questions. Thank you very much.
Great. I think that wonderful talk is very exciting, and thank you. Before we take like an audience question, I have one question regarding the liquid metal technology. I think it's pretty exciting and promising technology for wearable sensor. I know for diabetic feet, temperature is also important biomarker as well. And how do you think about using liquid metal to monitor temperature? And also, in that case, even you monitor temperature, even when you monitor pressure, how the temperature will affect your pressure sensor in that case?
Right. Yeah. So you're quite right. In fact, temperature is also one of the factors that manifest in foot diabetic ulcers. Actually, we haven't quite looked at that because when we developed this Insole, we already know that there's ulcer there, or patients are recovering from the ulcer itself. And so we can actually personalize the smart Insole by positioning the sensor near to or where the ulcer is. In fact, temperature would be very good if we want to look at preventing the occurrence of ulcers, because at the point where the ulcer is about to form, there's actually an increase in temperature. So that is something that will be actually also of interest to us. But we were actually during that time looking at already patients who already had an ulcer or recovering from it. And so we just using the sensor as a means for us to measure pressure and to prevent the patients from exerting too much pressure on that particular location.
Okay, great. Let's see the audience question. There's one question, Professor C.T. Lim. Thank you so much for your wonderful talk. For the personalized medicine of cancers, do you have successful demos to share with us, and how much it costs, and which hospital can do this actually?
Right, yeah. So basically so when we first started this cancer, this CTC work, initially we were looking at counting number of cancer cells from say 1 ml of blood as a means to stage the cancer patient. That was when we first started about 15 years ago. The whole field has now moved towards more sequencing. That means in detection of mutation. And in particular, we are looking at mutation that is treatable by drug. So in my presentation, I did show two examples, right? The lung, where we are looking at ALK mutation, the breast, where we're looking at HER2 amplification, and those two are treatable by drugs. And we have indeed, from working with clinical samples, be able to detect both ALK mutations and HER2 amplification. And once we can detect them, then we know what is the appropriate drug to treat the patient. So we did work with clinicians to do clinical tests and then be able to spot a mutation and be able to actually administer the right drug to the right patient. And in terms of cost, so the treatment is, I mean, the chip itself, I guess it's around about $100 compared to, actually there's an FDA approved system, and that test is about $800 to $1,000. So for our chip, I think it's much more less than that.
That's great. Let's go to the next question. So congratulations, Professor Lim. It's really challenging for professor to bridge through research in the lab and commercialization. How do you balance your career and how to manage your two different teams?
Right. Yeah. It's well, actually, my students are also listening in. So actually, I know they know that I meet them every week, at least for a big group meeting, and I do split my team into different groups. One group is Mechanobiology, which is doing basic research. One group is on Microfluidics, and then the third group is on sensors. And so I do give my students a lot of freedom to try out things, and I don't really push them very hard actually in terms of publication as well. I mean, the most important is to do a good proper research, make sure the experiments that you design is robust and the data you get is accurate and correct. I think once, for example, if we develop a technology that I found that is very useful and very commercializable, then I may think about the next step, whether we want to go ahead to further develop it into a product. If we do want to, then we want to have a spin-off company, or do we want to license it to another company? So the process that I start off with, it will be to start with the research, basic research, and then see how it goes. At the end of the day, if we think it's translationable and it's going to be helping to solve a very important problem, then I might go further to see how we can translate, commercialize the technology.
That's great. Another question, Professor Lim, for the equipment in hospital to split and culture the cancer cells, do you have agents in mainland China, and how much is actually?
Oh, the culture, right? The CTC culture, right? Yeah. Not at this stage, not yet. I mean, so far we've still been doing it in Singapore. We are very confident of breast cancer because we have done it almost 400 over clinical samples. Now we are looking at other cancer types. Like pancreatic cancer is one of them. Lung cancer is also the other one. Because different cancer type would mean that we have to use different protocol in terms of culturing the cancer cells. And so that will actually take time as well. We haven't actually quite explored bringing it to China. I mean, we'll be happy to do that. But at the moment, we are actually exploring different cancer types to see whether we can also culture other types of cancer apart from breast cancer.
Great. Another question is Professor Lim for the smart Insole of diabetics. Very good idea. And can it be used for acupressure, which is very useful for the elder patient person?
Oh, you mean acupressure as in exert pressure at the foot of the patient?
Well, we cannot contact well, I guess.
So if I interpret the question correctly, it's like, can we maybe apply pressure onto the bottom of the foot of an elderly person? So ours is a sensor. We measure the pressure, but I think we can probably shape the insole into something that can apply, acupressure to the bottom of the foot, and also be able to quantitatively measure the pressure that's exerting over there. So I do not think it's impossible. I think it is possible. Just we need to think about how to go about doing that.
Okay. One more question. Hi, Professor Lim. I'm a student from Harbin Institute of Technology. Thanks for your fantastic work. You exploited a lot of application of integrating microfluidic techniques. Could you give some comment about the advantage and prospects regarding the combination of microfluidics and wearable sensors?
Right. Yeah. So I did mention there are actually many sensors out there that's been developed, and the reason why we use microfluidics is because my expertise is microfluidics, and just giving us a challenge to see if we can do something out of it. But it turns out that indeed we were able to create a sensor out of the microfluidic chip. I guess it has its pros and cons. Firstly, if you use a microfluidic chip, we are not talking about very, very thin, almost single layer, a very thin layer of sensor. For example, Professor John Rogers and a few other groups have been developing extremely thin sensors that can be stuck onto the skin. But we're not worried about that because the microfluidic channel, in fact, when we talk to users, they would prefer something thicker because they would like to be able to hold it and be able to stick it and thereafter be able to peel it off quite easily. The advantage, of course, is using the liquid metal itself, because the liquid metal itself is actually very, it's a liquid, so it's extremely deformable and very sensitive. And so it itself can act as both a kind of a tactile sensor where you can press forces and measure it. But at the same time, if you were to twist it or bend it, we'd still be able to measure those forces as well. As compared to a very, very thin sensor, when you bend it, I'm not sure how well you can measure bending force, for example, or twisting force. So there's pros and cons to each of these sensors that we are developing.
That's great. I think thank you very much again for giving the wonderful talk. I do want to add one more sentence. I think given the COVID-19 recent issue with COVID-19, Professor Lim's one of the startup company actually working on COVID-19 tests had developed a kit for quick detection antibody tests actually.
Right. I don't have time to talk about it, but we are indeed also developing a micro COVID-19 test kit using microfluidics. Hopefully it should be out soon. We managed to actually finish developing it. So looking forward to actually getting it out for use later
great.
on.
Thank you very much.
Okay, great. Thank you, Wei, and thank you, Professor Lim. I think you are really, really great person. Yeah, deliver such a nice talk and so many useful technologies. And this is a certification for you, Professor Lim. I can ask talks, always connect the world and universe. I think your technology already connect the world and universe. And many, many people in the world was looking for you, technology, your equipment, and this can go to their countries, not only, go to mainland China. I think, many, many countries looking for that. Okay, this was for you. Thank you so much.
Thank you so much. Thank you, Alice. Thank you for the invitation.
Okay, yeah, great. Today is really, really wonderful. So we move into the end of this talk and we will announce for next week. Next week we will have two wonderful speakers too. One is Xu Sheng from University of California and San Diego. Yeah, he's doing many interesting works, for this flexible electronics. And another one from University of California and Los Angeles, UCLA. So is Azakan. He is an amazing person. He will tell us a story about toward a thinking microscope to deep learning based, microscope for the different sensing technologies. So yeah, please stay with us next week. Listen to these wonderful talks. And this tomorrow we will have another talk in Chinese session. Is for the the chips, the integrated chips in the smartphone. If you are interested to know what kind of chips in your smartphone, please join us. You will hear the stories and you will see all these chips and different kind of chips. And we have many speakers to get on the stage. This was 10 to get on the stage since this week. Xiaodong and City Lim already did the job. Xu Sheng and Azakan will come next week. Deiji Tahek will come after, and Everly and my Mona will come, in the 2 weeks later, and Eric and Paul will come get on the stage too. So stay with us and with all these wonderful speakers. Yeah, will come up. And if you are interested to get the technical report, please, do scan the code to get the report. This will come in the early June. We will have my Young Scientist Forum. This is free for registration now. We have totally 53, wonderful young scientists to get on the stage to deliver talks and to win the title. So if you're interested, please, join us and do the registration. You will, watch this 3 days program. That's really wonderful talks too. And we have a special, in July is for the laser. This year was the laser's 60 years anniversary. Everyone knows that how laser important it is and how it changed our life and our world. So yeah, we together with the Light, the journal will have these special sessions with Lighting the World to celebrate the 60th anniversary of the laser. So please join us with these 3, wonderful speakers and 1 superstar with hoster. And the next I can X ACS Nano Rising Star will be September 1st. So be sure to get to that. This was a bunch of the speakers here waiting for you. So see you next week. We hope you together with us every week, every Friday. Okay, see you. Bye bye. Have a good weekend. 行，那
中间你会提问一些问题是吗？然后我们
对，normally 是这样的，就是我会先抛砖抛1-2简单点的问题，然后大家就来谈，因为你们2个都很能说，我也不用。